Hi, I'm Eric Rathfelder. This roll call training is meant as an update for first responders who have already been trained in the use of Narcan. There are changes in the delivery device and dose you may see in the future. If your agency currently receives Narcan through our office from the state grant that our office manages, in the past you've received a device from Amphastar Pharmaceuticals that delivers 2 milligrams of Narcan per dose. Future stock supplied by our agency will be an Adapt Pharma device that supplies double that dose at 4 milligrams per dose. There are some nice features of the new device, the biggest being that it does not require any assembly, and it's also made of plastic, so there's no glass vials involved like the ones you currently use. There's more information on this changeover in the MELREMS Advisory 17-08, and I'd encourage you to review that because it contains more information than what is in this roll call presentation. The indications and the situations when you'll use Narcan remain the same, and I'll review those on the next slide. The indications for when you should use naloxone or Narcan haven't changed with the new delivery device. This slide is a reminder of the situations in which you should be administering Narcan. Initially, you should decide whether or not you suspect that the person has overdosed on an opiate or opioid. This might be based upon paraphernalia that you see around the scene, the nature of the call, or information provided to you by witnesses. If you do suspect an opiate or opioid overdose, then check to see if the person is responsive to painful stimuli. Remember, what we care about is making sure the person is breathing effectively. So sometimes if you provide some painful stimulus, usually in the form of a sternal rub, to the patient, they may wake up or they may be roused enough that they begin to breathe or protect their airway on their own effectively. If you do give them painful stimuli, and they are now breathing effectively, you can stop there, turn them on their side in the recovery position, and just monitor them until EMS arrives. However, if you provide painful stimuli and it's not effective in making them breathe appropriately, check their breathing status. Is it normal or fast? If so, Narcan is not indicated, turn them on their side. Is it slow? Is it ineffective? Does the person have snoring respirations, and is their mouth blue, and do they look like their breathing is ineffective? If that's the case, provide naloxone, assist breathing if equipped, and provide any other first aid that's appropriate for your level of training. The third category, no respirations or gasping respirations, is basically somebody who is in cardiac arrest. If that's the case, the most important thing is to provide chest compressions or CPR. CPR should not be delayed to give intranasal naloxone or Narcan. If you do have enough individuals providing high quality CPR, then you can provide a dose of Narcan as well. But don't delay CPR in order to give Narcan, even if you believe the cardiac arrest is from an opiate overdose. Narcan or naloxone is known as a competitive antagonist. What this means to you is that it reverses an opiate or opioid overdose, and it blocks the effects of the opioid from being able to have that overdose progress further. In general, it takes 3 to 5 minutes to work, and it's effective for 30 to 90 minutes. What this means is don't expect to give your Narcan and have the person begin breathing immediately. It may take 3 to 5 minutes to work, and if it doesn't work in that amount of time, you can give a second dose if you still suspect a drug overdose. It's effective for 30 to 90 minutes, and after that it wears off. Narcan is not addictive. In general, it is harmless if there are no opioids present. So if you give it to a patient who was not actually experiencing an opioid overdose, even though you thought they were, there shouldn't be any ill effects, and you cannot overdose on Narcan. This slide simply demonstrates what it looks like when Narcan works. If you look on the left, those blue spheres represent an opioid, which is bound to the receptor site in the body. Once you give the naloxone or the Narcan, it removes the opioid from the receptors and replaces the opioid with itself, effectively blocking the opiate overdose. This is the new packaging and delivery device for future Narcan stock that you'll receive from our office. If you look at the supplied line on there, notice it says 4 milligrams per 0.1 mLs. Basically, you're giving twice as much of the drug, but in a much smaller volume of liquid. One of the best features of this new device is that there's no assembly required. The box that you get will contain 2 blister packs, each of which has 1 device or dose of Narcan contained in it. In order to administer your Narcan, all you do is remove the device from the package and it's ready to go. Put your thumb on the plunger, put 2 fingers around the nozzle, and insert the tip into 1 nostril. Once you depress the plunger, all of the medication will be administered. One difference between this device and the old administration device is that with the old administration device, you had the ability to put half of the medication in 1 nostril and half in the other nostril. But with this device, once you depress the plunger, all of the medication will be delivered. Therefore, you're delivering the entire dose in 1 nostril. If after 3 to 5 minutes there was no effect and you need to give a second dose, use the other nostril when you deliver your second dose. But again, this device will deliver the entire dose in 1 nostril. A few notes on storage for this drug and this particular device. It's a prescription drug, but it's not a controlled substance. It should be kept in a room temperature environment, somewhere between around 59 to 77 is what's recommended by the manufacturer. It shouldn't be stored in direct sunlight. And just like the old devices, the medication will expire. There's an expiration date printed on the packaging. In general, usually it's about 2 years from the date that you receive your Narcan. Try to make every effort to replace your Narcan before it expires. And once again, when you replace your current stock of Narcan, whether it's because it's expiring or you've administered it, you will receive these devices in lieu of the old devices. As a reminder, sometimes when you rapidly reverse somebody's opiate overdose, they may become combative. This is a rare case. Usually they will be disoriented. It's likely that they'll vomit, especially because we're giving such a large dose, double the dose now that we used to give. Try and reorient the person. Try not to get vomited on, and be aware that they could become combative. Again, that's a rare situation that they do. After you give the Narcan, I would recommend you turn the patient on their side so that their airway is protected if they do vomit. And again, if there's no improvement within 3 to 5 minutes, give them another dose in the other nostril if you still suspect an opiate overdose. When patients are given naloxone from an opiate overdose, they should be transported to the hospital by EMS. If push comes to shove and that's looking like it isn't going to happen, then consider doing a mental hygiene arrest under 2209 if that becomes necessary. And when you're finished, don't forget to complete the usage form. Most departments have it uploaded on their intranet, or you can fill it out on paper in paper form if you don't have a fillable PDF available to you. A few other reminders and considerations. Remember, with this device, you're giving the whole dose in 1 nostril, not splitting it between nostrils like you did with the old device. Also, you're giving 4 milligrams now, not 2. That's important to note on the usage form in some way. Either write down that the dose you gave was 1 4 milligram dose or 2 4 milligram doses. And it's also important that EMS is made aware of the dose you gave. If you can't remember how much it was, just show EMS the device you used, because the dosing is written right on the device itself. So if you gave 2, tell them that you gave 2 and show them that device, and they'll know how much Narcan you gave. As always, if you have any questions related to Narcan or the grant where Narcan is supplied to your agency, please get in touch with the Division of Pre-Hospital Medicine here at the University of Rochester. Thank you.